So we're going to talk about emotions and pelvic pain in women. And first, I want to share with you that it was hard to prepare this lecture because I know that behind what we're going to talk about, there's a lot of actual pain. So these are real lives, these are real people who suffer from real pain many times over prolonged periods of time. So that made it a bit difficult to prepare this presentation. We are going to talk about emotions and pain, so it's going to be an emotional conversation. And one last remark is that I feel as a man, as someone who was born as a man, that this is a topic that ideally should be conveyed and should be explained by women. The reason why I'm doing it is that I think it's important to raise awareness to that and to make the novel treatments that we have, the new approaches that we have more available. So that's like a personal note. Just to give a little bit of context, a little bit of background. So until recent years, around 2 to 3 decades ago, we had only two mechanisms to explain pain, to explain how pain is created. One is called the nociceptive, which means don't be alarmed if you're not familiar with the scientific medical terms. I'm going to explain it. It's very simple in simple terms. So nociceptive, generally it means damage to the tissues of the body, like when we cut ourselves or are injured or get like hit by something, that's nociceptive pain. And there's neuropathic pain. Neuropathic pain means that the nerves are damaged. The conducting nerves that have to do with pain and other sensations are damaged. For instance, in diabetes, the nerves after many years of suffering from the disease, they become damaged because they get less blood supply. So that's neuropathic pain. So nociceptive and neuropathic, these were the mechanisms that we knew. But in recent decades, there has been a new understanding of a new mechanism of pain that is called nociplastic pain. Nociplastic pain, or more commonly, it is referred to as neuroplastic pain, is real pain in the tissues of the body that is not related to actual damage in the tissues, in them. Where does it originate? It originates from our brain. So it's very real pain. When you suffer from it, you wouldn't know that you are suffering from something that's coming from your brain. It feels like any other pain. It can seem, or the sensations are like any other pain that's out there. And the mechanism would be, so to speak, internal, coming from your brain. So that's a new understanding. And this understanding is very important because when there's no tissue damage, we can treat the pain through training our brain, which is a great, this is great news for people who suffer from chronic pain because it opens up new possibilities to heal that pain. So just saying that we want to rule out other medical diagnoses without considering the possibility that the pain is coming from the brain is in many cases not enough because we don't want to leave neuroplastic or nociplastic pain as last resort or something that we consider last because sometimes people go through many diagnoses and many attempts to diagnose where the pain is coming from without considering what might be the real cause. So this should become more and more a part of the medical discussion. What happens in nociplastic pain or neuroplastic pain, these are interchangeable concepts, is that brain circuits take over the pain process. So what's going to happen, and the reason why the pain is continues in the body is because what happens in the brain. There are neural circuits that form and become stronger and stronger, which makes pain last longer. Okay? But it's also reversible, which is important to know. There are ways to reverse it. Who is this relevant for? So, first of all, ask yourself, if you suffer from pain, from chronic pelvic pain, might this be relevant for me? Or if you're treating patients, if you're a doctor, if you're a nurse, if you're a psychotherapist, psychologist, physiotherapist, think to yourself, could that be relevant to one of my patients, one of my clients? So let's make this a reflective, self-reflective kind of listening, kind of presentation. So let me present something. When I finished medical school, when I graduated from medical school, there were questions that I didn't even think it's possible to ask. And one of the questions, again, back then I didn't even know that it's possible to ask that. One of those questions is, could PMS, premenstrual syndrome, the pain that many women feel around the menstrual cycle, around their period, could that also be, at least in part, neuroplastic pain? So something that's augmented or enhanced by things that happen in our brain, which is thoughts, emotions, conditioned responses, behaviors, etc., learned behaviors, etc. So that was a question I would never imagined that someone can ask. And actually, I never asked it. But what happened was, and after instructing and guiding many people in healing their back pain through using such techniques, a few women that healed, that recovered, started asking themselves, so, okay, the back pain was over, and it was done by training the brain, learning about pain mechanisms, and training the brain in a way that releases the pain gradually. There are great studies about this, by the way. And they started asking those questions themselves. And I looked at those discussions. We have a forum, we have a group, and they started asking those questions. Here I posted a real discussion between two women, and one is asking, "Hello, friends. This post is for the women among us. Do the days before your period and the first days of menstruation intensify the pain? Are the pains at their peak? If anyone has experienced or is experiencing this, I'd love to hear your response. Is there a connection?" And this woman asked that. And then a whole discussion started, and you can read one of the answers. Um, since my back pain has significantly reduced or disappeared due to discovering TMS, TMS is tension myoneural syndrome, a diagnosis that an American doctor named Dr. John Sarno coined, I think 50 or 60 years ago, and connected emotions and pain. So since my back pain has significantly reduced or disappeared due to discovering TMS and doing the work, training the brain, my menstrual pain has also disappeared to the same extent, along with the connection between my period and the worsening of back pain. I discovered it's the same brain mechanism. So those brave individuals started exploring the possibility of reducing PMS symptoms through training their brain. Okay? And this is what they've discovered. And that was the first time when I asked myself, okay, so what other pain syndromes in women could be brain-based? And this led to many, many, many discoveries, as I would like to share shortly. So going back to Dr. Sarno, which we've just mentioned, Dr. Sarno worked in New York. He was a rehabilitation expert, and he treated tens of thousands of people with chronic neck pain, back pain, sciatica, headaches, migraines, and he he said that, according to his observations, people who tend to develop more of what we nowadays call neuroplastic pain are people, or back then he called that TMS, tension myoneural syndrome. He said that, according to his observations, the people who develop that more than others are perfectionists and also people who wish to do good to other people. They try hard to please or be good. And I've mentioned that this presentation is an adaptation of the lecture I gave in the conference. So in the conference, so I was standing on the stage giving this lecture, and I wanted to see what people in the audience think. And there were around 180 professionals, men and women, from professions like medicine and psychologists and physiotherapists and natural medicine practitioners. So I asked the audience a question. Who do you think, who do you think falls into these categories more? Men or women? So before I reveal what happened in the conference itself, I want to ask you to write in the comments below, what do you think? Who tend to be more of these personality tendencies, perfectionists and trying to do good? Men or women? So the answer was quite shocking, I have to say. 99% of the people in the audience voted for women. And there was one vote, a single vote, that said that men were more, have this tendency more than women. By the way, this one person was my, still is, my mother-in-law. So that's also a personal story. So that was the survey, and I'm really curious to see what you would think. So write in the comments below, please. I want to give three examples that connect directly to this last topic. So in Switzerland, just to give a few historic examples of why most probably women were and still are in many instances using those strategies in relation to others. So in Switzerland, for instance, women were allowed to vote only in the early 70s of the last century, 1971. That's one example. So we're talking nowadays, we talk about equal rights, but this is not such a faraway history. It's only 5 decades ago. In Portugal, um, my wife spoke with her personal trainer in the gym, and she shared with her that in the 70s, women were not allowed to leave the country without their husband's permission. Okay, again, this is very near past. And I want to share a more personal story. I want to share with you something about my trailblazing granny. She was a very unique person. I really loved her. And there are two things to know about her. First, she was very meticulous. And the second is that whatever present you would give her, no matter what we bought her for the holidays or birthdays, she would always find a fault and return it back to the store. When I was 15 years old, my grandmother called me and told me, Nir, we're going to build a garden shed. And I said, okay, grandma. And then we geared up, we assembled all the materials and started building this shed. And we built it very meticulously, very diligently, and also with lots of humor and fun. We used to laugh a lot together. And then when it was completely built, she took a measurement tool and then she saw that there was a slight tilt, a really slight tilt to one of the sides. And then she told me, we need to break it down. We need to build it again. And I told her, okay. Remember, whatever she was getting, she received, she would give back. So here again, it was the same. So we broke it down and started building it again, and we laid the foundation, and then she measured again and told me, this is not level, and we need to build it again. And at this point, I told her, okay, grandma, I respect you, but this work is yours from now on. I had other things to do. when I was a teenager, as we all do. So why am I telling you that? Because her story, her personal story was very unique in this sense. When she turned 40, the kids were already older and they could handle quite alone. They were handling their lives okay. And she decided that she want to build herself a career, earn a living, and basically break break free, okay, financially free. She wanted to be financially free and has have this freedom. And she went and studied a profession and started working in this profession. She bought herself a car and had a salary and had her own money and her own bank account. Why is this like today doesn't sound so dramatic, right? But back then, it was so extreme for a woman that comes from a traditional Middle Eastern family to decide that she wants to get her own job and get her own salary and and have her own car and be independent. That was very, very, very unique. So just to share with you a few pictures of my grandmother, that's her in her 50s, and this is how she looked when she was in her, I think it was in her 20s, early 20s. And this is how she looked when a couple of years before she passed away at the age of 97, completely clear, completely aware. Let's get back to now. Let's go back to now. Let's go back to the present. Um, in 2021, in the Lancet, one of the most important medical journals in the world, this paper was published, and the paper explained what nociplastic pain, pain that's called neuroplastic pain that's generated in the brain. And look at this table where they show that chronic primary pelvic pain syndrome in women, pain in the pelvic region, look how common it is. It affects 15% of women, where 60 to 80% have no identifiable somatic pathology, meaning they don't have a medical diagnosis. They ran all the tests, they checked everything, but there's no clear diagnosis, which means that they suffer from pain, but they don't have a title for it. So it's chronic pain without a medical explanation. If you look at the numbers, it's around 10% of the women. 10%, 1 out of 10. So this is how prevalent it is. This is how common such pain is. 1 out of 10 women. And as a consequence, also without a proper treatment. So if there's no structural cause, neurological cause, what causes their pain? Let's take another look at more data that is coming in recent years. There is a very strong link between emotions and pain. This link has been established in the huge ACE study. ACEs are adverse childhood experiences, which means negative experiences in early life. And the ACEs, these adverse experiences, are, for instance, physical abuse, emotional abuse, and unfortunately, sexual abuse, emotional or physical neglect, mental illness in the household. One of the parents is mentally ill and not balanced normally. And if they're not balanced, then it's more severe. The mother is treated violently, and the children watch this violence, unfortunately, again. When there's substance abuse, one of the parents is using either pills or drugs or alcohol, and divorce is also one such experience, sorry, and also when one of the parents is incarcerated. So this is also one of the ACEs. And there has been there are links between bladder pain and interstitial cystitis. Um, that are linked to ACEs, to adverse childhood experiences, to you we can call it childhood traumas. And there's a link between ACEs and chronic pelvic pain later on in life, and also pelvic pain and discomfort in vaginal penetrating procedures, such as inserting a tampon, going through gynecological examination, and of course, intercourse. So all of these can cause more pain in women who went through childhood, who experienced childhood trauma. So here the links are established. We know that there are links, and many times emotions are driving or are the cause and driver of pain in the neuroplastic mechanism. Which conditions? Let's talk about healing now, because the whole idea of this presentation is to talk about new healing possibilities. So these conditions, these are things that me and my team have treated successfully over the past decade and even more. Endometriosis, vestibulitis, this is the vulvodynia, this is pain around the genitals, irritable bladder, other inexplicable pelvic pain syndromes, uh, pre-perimenstrual syndrome, and vaginismus, which is contraction of the muscles around the vagina during intercourse attempts. So all of these conditions could be treated successfully. And below, and of course, it's very important to contact a healthcare provider, either a doctor, a psychologist, or other therapists that are qualified and know how to treat these conditions, that have experience in treating these conditions. I've linked a link to a directory of such professionals. You can go into this directory, find someone who's close to where you live, and make the communication and connection and help and get this professional help. So check the link below this video. The principles of therapy, first, is to validate and acknowledge the experience. Pain that originates in the brain is real pain. It doesn't mean one invents it. It doesn't mean it's all in our head or something like that. It's very real. It's very physical. So the first step is to acknowledge it, understand it as it is, and be compassionate towards oneself. Okay? And this is crucial. This is important when treating pain. That's the first step. The second step is learning more about the neuroscience of pain. It's called PNE, Pain Neuroscience Education, learning and understanding how the mechanism works, and also that in many cases it's reversible. It's something that we could heal. We want also to integrate emotional processing, which includes, for instance, fear avoidance behaviors, thinking about the pain as a catastrophe instead of understanding how it really is created and what one can do about it and with it through training the brain. This is very accessible to many, many, many people. And techniques for emotional awareness and expression. There's even a method, a psychological method that's called emotional awareness and expression therapy that helps dealing with such pain, such emotions that are related to pain and the pain itself. The fourth principle is gradual return to activity, expanding the sense of safety and comfort, which could be, for instance, sitting more, learning to sit more, traveling, going back to sexual activity gradually, preparation for pregnancy, all those aspects. Of course, this is very important to do with a healthcare professional, someone who has experience in this field. And the last point to remember that this is a gradual process. It happens over time, and patience is needed. Progress will happen, improvements can happen and will happen, but it takes a while. It takes a minimum of 4 to 6 weeks and up to 3 to 6 months normally to see major improvements. But think of a year-long pain or 5-year-long pain or 10-year-old pain, and I've seen also people with 30 and 40 year-long pain that improves within a few months to a more bearable amount level, and then improves even more towards more and more improvement and freedom in daily life and daily activities. This is achievable for many, many, many people. So having said all that, I'm really interested, really curious to hear your questions. Please, if you have a question around this topic, whether a more technical one or a deeper one, please write them in the comments below. I'm more than happy to read your questions and answer as much as I can, as much as possible. Of course, refer you to other resources when needed. This is meant to help to open up new possibilities for diagnosing and healing chronic pelvic pain in women. And to conclude, there's this sentence: I hope, truly hope, from the depth of my heart, that this has been helpful for you, that it will help you on your healing journey. And please let me know what you think in the comments. I'm more than happy to try to help and direct you to the right resources as much as I can. Thanks for being here, and be well.